Hello friends, welcome to FastCoder 21 free medical coding YouTube channel. So always my intention is to help the medical coders as much as possible by providing latest updates in medical coding. So in my channel you will get all the latest updates about inpatient, outpatient as well as HCC and all type of medical coding specialties. So these are about me, so my qualification as well as my experience. So today's our session name is Top Missed Hcc Conditions. If you want to know more about this, please watch, like, comment, share and subscribe this channel in order to motivate and in order to get more valuable resources in medical coding. First, we need to know about what is HCC. So basically HCC means hierarchical condition categories. Where do you use HCC? So most of the time you will use HCC coding in risk adjustment coding or RA. So as all of us know, HCC completely depends on ICD-10-CM diagnosis. So it does not have any type of procedures. So CMS publishes these HCC conditions based on prospective approach, where base year data is useful to expedite or predict future costs. For example, if the patient's base data is 2023. So this 2023 data is useful to predict future costs in 2024 for the same patient. So now we will start with our top missed HCC conditions. So first we need to know about cerebral infarction. So in cerebral infarction we are having two types of coding. One is for current and second one is for history. So when do we code current condition? So for example, patient is having previous CVA and currently patient came in with any type of paralysis or weakness, we need to code current condition like CVA with residual conditions. For example, patients come and he does not have any type of residual deficits like any type of paralysis or weakness. So that time you need to code history code. So whenever you will find CVA in the document, you need to check whether patient is having any type of residual deficits or not. If the patient have residual deficits, you need to code it as current. If the patient does not have any residual deficits, you need to code it as history. So next condition is myocardial infarction. So here also most of the coders get confused. So basically in myocardial infarction also we are having two types of codes. Old myocardial infarction as well as the acute myocardial infarction. So old myocardial infarction, when do we code old myocardial infarction? If the patient has myocardial infarction more than 4 weeks old, we need to code it as old myocardial infarction. So if it is less than 4 weeks, we need to code it as acute myocardial infarction. Or usually in the document we can see as MI. So one more topic is DVT. Here also we are having two types of code. History of DVT as well as current DVT. So usually DVT means deep vein thrombosis. So whenever you want to code deep vein thrombosis, you need to check the documentation whether patient's DVT is resolved or not. If the patient DVT is resolved, you need to code history code. If the patient DVT is not resolved, we need to code from current code or acute code. So next one is depression. So whenever you code depression, you need to check the documentation for specificity, whether it is any type of single episode or double episode, recurrent or initial. And also one more is hypertension, CKD and heart disease. So whenever in the documentation if you find hypertension, CKD as well as the heart disease, you need to check for combination codes. So ICD-10-CM is having plenty of combination codes related to hypertension, hypertension as well as CKD as well as this heart disease. And also one more condition is diabetes with CKD or diabetes with all other conditions or combination codes. So whenever you see in the documentation, if the patient is having diabetes with CKD, you need to code combination code. So what are the most common HCC missed conditions? So like alcohol abuse, Alzheimer's disease, arthritis like osteo and rheumatoid arthritis, like asthma, atrial fibrillation, next autism spectrum disorder, cancer like breast, colon, prostate and lung cancers, COPD, asthma. These are the chronic conditions along with drug abuse, heart disease, heart failure, or any type of hepatitis, HIV or AIDS, lipidemia, ischemic heart disease, osteoporosis, and schizophrenia or schizophrenia. So whenever you want to code HCC conditions correctly, you need to check for ostomy status also. Otherwise, you can call it as artificial opening status. So these are very important in order to predict the future costs. So in the documentation, you need to check for artificial opening status also. Along with that, you need to check for dependence. So dependent status impacts the RAF. Usually we will call it as risk adjustment factor. So you need to check for dependence in the documentation like hemodialysis status or any type of respiratory status or respiratory dialysis status. Next, you need to check for long-term use of insulin, and also you need to check for amputation status, and also you need to check for functional quadriplegia. So most of the time coders will confuse for coding diabetes, CVA as well as DVT and myocardial infarction. So whenever your documentation contains all these conditions, you need to check the documentation properly in order to code and in order to provide RAF score appropriately. So here we can see one image. So top Missed Hcc conditions. Like always you need to concentrate on major depressive disorder and bipolar disorder. So you need to check the severity of the depression as well as whether it is single or recurrent. Okay, see here single episode mild, recurrent moderate, recurrent in full remission. Next one is seizure disorder and convulsions. So you need to check this HCC 79 and also you need to check for use, abuse and dependence, and also as we have discussed previously you need to check for CHF or like congestive heart failure, and also you need to check for specified heart arrhythmias as well as coronary artery disease, diabetes with combination codes as we have discussed previously. Like most of the time in the documentation you will find diabetes with CKD or neuropathy as well as PVD. So whenever you are having these conditions, you need to check for combination codes, and also you need to check for vascular disease like aortic atherosclerosis, and also you need to check for dementia, other endocrine disorder like hyperlipidemia and hyperparathyroidism, and also you need to check for pulmonary diseases like chronic bronchitis, COPD, emphysema, and also you need to check for inflammatory bowel disease. So here you are having HCC 134, 35, 36, 37 and 38, renal related to CKD, and also you need to check for complications of prosthetic devices. See here pain due to internal orthopedic prosthetic device, and also you need to check for coagulation defects and also morbid obesity, malnutrition and amputation status as we have discussed previously. So thank you friends, thanks for visiting Fastcoder 21. If anyone looking for same day surgery training, contact me at vincentmedicalcoder@gmail.com.